I am pleased to present a work in progress, improving vaccine compliance in a hospital setting. This quality improvement project is being conducted at Ashok-One Hospital in Mumbai, a unit of Shalom Life Care. Authors include Dr. Mathew Peedikayil, myself, Dr. Tara Kinra, Dr. Vinita Mathew, and Ms. Vandana Bhatia. The problem we set out to address was vaccination compliance. We analyzed the opportunities for vaccination as patients and their relatives come to the hospital with receptive attitudes when they are in need. Hospital staff are generally seen as trustworthy and giving scientific advice. The vaccine stock is readily available from our chemist on site, and it is easy to administer vaccines by our nursing sisters in the casualty room as soon as a decision is taken. However, the barriers include lack of awareness among patients and staff, including about the vaccine's preventative benefits, eligibility criteria, the cost effectiveness of taking a vaccine compared to the cost of hospitalization or mortality, and the efficacy and safety of the vaccines. In addition, lack of tools to implement prescribing as a routine practice for the clinicians was seen. Our initial aim was to increase pneumococcal vaccination rate with Pneumovax by 30% above baseline within 1 month for OPD patients screened as eligible for this vaccine and advised to take it by their doctor. A secondary aim was also added to increase influenza vaccination rate by 50% above baseline within 3 months for the same OPD patients. We continue even now to sustain the quality improvement that was achieved and look for new ways to improve further. Our main methods to promote awareness were through patient screening conducted by our volunteer coordinator, Ms. Vandana, in the OPD waiting room. She excluded those already vaccinated and identified those with age or medical condition indicating vaccination. She encouraged these patients to discuss the vaccines with their doctor and gave them an educational brochure in their language. Later, she followed up after the visit to verify if they were advised by the doctor for the vaccine. She also followed up this group of patients to verify if they took the vaccine. Additional methods included teamwork and training, as well as additional tools that were developed. Dr. Vinita advocated to administration who supported this project, and they sponsored the first all-staff influenza vaccination drive. Also, members from each department were invited to a staff training led by myself to promote awareness about the vaccines. For tools, we found that an educational slideshow to be displayed on the OPD TV display and a poster in the waiting room were helpful. Dr. Mathew also developed a self-inking stamp and a patient advice for the new electronic medical record to aid in the prescribing for the clinicians. The outcome of this project exceeded our aim as we found that there was a 4-fold increase in vaccination rate as a percentage of total monthly OPD visits for Pneumovax compared to baseline. And there was a 3-fold vaccination rate increase for influenza. As the coronavirus pandemic hit Mumbai in March, we were challenged with a sharp decrease in the number of OPD walk-ins, as well as in vaccinations. However, we continue to work at sustaining and improving vaccination to protect vulnerable patients against these diseases known to be associated with worse outcome with COVID-19. The lessons we would like to highlight for you include the importance of teamwork, training, and tools to improve the quality of our healthcare and health of the patients we serve. Through teamwork, all members of the healthcare team from various departments have an important role to play together. Training helps us to continue to be aware of the best practices, including the indications for the vaccines and the value of prevention in the cost and benefit ratio. Relevant tools also help the patients and the staff alike so that we can have better standards of care. Thank you for learning with us how to improve quality in our healthcare and the health of our patients.